Tuberculosis is the leading cause of bacterial death in people who are HIV infected in southern Africa. That's a very important statistic. So what we need to do is we need to get better diagnostics so we can determine if a person has TB. We need to treat them, and we need to treat them appropriately, because there's a growing concern about multiple drug-resistant and extensively drug-resistant tuberculosis. And if that's the case, we've got to know that we're treating them with the right drugs.
Welcome back to In Focus. Today is World TB Day. That was Dr. Anthony Fauci, a man who has led the research on AIDS since the early 1980s.
And in that particular piece, he was speaking with In Focus health correspondent Linord Moudou, who joins us today.
Hello.
And we know you got a lot for us today.
Yes, indeed. Today is World TB Day, as you mentioned earlier, and we're looking at HIV/AIDS in particular because the combination is very deadly, according to experts. Dr. Fauci is the leading AIDS researcher at the National Institute of Health. He has been instrumental in developing an understanding of the HIV virus. More from Dr. Fauci in a moment. But first, Pope Benedict's recent trip to Africa focused attention on the Roman Catholic Church's opposition to the use of condoms, even to combat HIV/AIDS. But the church is actively involved in the fight against AIDS in Togo. Last week, the church focused on HIV/AIDS in Catholic high schools around Togo. The United Nations Development Programme sponsored the initiative aimed at young people already living with the disease. Casimir Koffi Kodo, a Catholic priest, led the initiative.
The Catholic Church wants to support young people and teach them about life and prepare them to enter society. That's why we decided that it was necessary to educate them about HIV/AIDS.
HIV/AIDS has killed more than 25 million people since the early 1980s, mostly in sub-Saharan Africa, and some 22.5 million Africans live with HIV. The Church teaches that fidelity within heterosexual marriage, chastity, and abstinence are the best ways to stop AIDS. It does not approve of condoms, but some church leaders have called for allowing their use in rare cases between married heterosexual couples where one partner has the disease. Some people in Togo are also commending the church for deciding to teach people about HIV/AIDS.
I think it is a huge step forward that the church authorities have decided that we should educate children about the pandemic. It is important.
The Togolese government says there are 180,000 people in the country living with HIV, and some 13,000 are children under 14. Jules Bossou is a student in one of Togo's Catholic schools.
Teaching about HIV and sexually transmitted diseases in schools will help Catholic youth resist the temptations that lead to getting the HIV/AIDS disease.
About 5 million people live in Togo. More than a fourth of them are Roman Catholics. Health groups often recommend the use of condoms as one way to avoid contracting HIV, but last week Pope Benedict said that condom use was not an effective AIDS prevention strategy. And I asked AIDS researcher Dr. Anthony Fauci for his thoughts on this.
Very clear from good scientific data that condoms play a major role in the prevention of HIV. If the point that he was trying to make is that that's not the only way, that there are other ways that you can prevent, then that's a fair statement. But to say in a negative way that condoms are not important, I think is not really consistent with the facts, the scientific facts. The other issue that was brought up in the conversation, at least from the quote that I heard, was that he thought it could make matters even worse. And in fact, that also is not the case, because there's no indication whatsoever that the widespread distribution of condoms in fact encourages people to practice risky sexual behavior. That just is not the case. No, I think abstinence has its place in the broad umbrella of prevention methods. We all know from extensive experience that abstinence doesn't work very well in many circumstances. When it works, it's terrific. But if you are focusing on abstinence only, when people are not abstinent, then they don't know about any of the other ways to protect themselves. So that's the concern.
The fight against AIDS goes around the world. Here in Washington, D.C., the nation's capital has the highest HIV/AIDS rate in the country, with 1 in 20 adults infected with HIV. And the rate of infection has jumped dramatically in the last 3 years. Voice of America's Jeff Swycord has the story.
How's everything been? How have you been feeling?
Feeling wonderful.
Edward is one of 15,000 D.C. residents living with HIV.
They think it was an exposure.
He tested positive 29 years ago.
Well, actually, I thought I had venereal disease, the STD, and it was syphilis. This is what I contracted. When they did my blood work and everything, they found out that I was HIV positive.
Edward is not alone. 3% of Washington residents have either HIV or AIDS, the highest infection rate in the nation. It's greater than in some parts of Africa and qualifies as an epidemic. The city's HIV/AIDS Administration Director, Shannon Hayter, says calling it an emergency is not enough.
This is an urgent and important and a long-term problem that needs an urgent and important and a long-term solution. I actually think calling an emergency sets the bar too low.
Whatever happened in the past, it has stopped.
It stopped.
Yes.
According to the report, the virus is being spread by men having sex with men, heterosexual sex, and intravenous drug use. The African American community is suffering the most. African Americans account for almost 8 out of 10 cases of HIV and AIDS. 9 out of 10 women with HIV/AIDS are African American. Edwards says people have become careless.
And then when you're caught up in the moment, alcohol and drugs, you're not thinking about condoms, you're not thinking about safe sex, you don't really care about it. All you care about is being with the person that you're with. And see, a lot of that goes on.
Some researchers say African Americans may have a genetic susceptibility for HIV. Experts say a major part of prevention is getting tested. Promoting condom use and needle exchange programs is also important. In Washington, 30% of new HIV cases can be traced to intravenous drug use. Chip Lewis is a spokesman with the Whitman Walker Clinic, an HIV/AIDS treatment center.
There's no magic bullet for it because you're talking about issues around stigma, discrimination, sexuality, sexual behavior, drug use, poverty. I mean, it's a very complicated situation that's really driving the whole HIV/AIDS epidemic in DC. So you can't just attack one aspect of it. You really have to work on all the aspects of it.
Well, you're a model patient. I mean, the most important thing is just taking the medications. So.
Edward's drug regimen has decreased the amount of virus in his blood to undetectable levels. For many living with HIV or AIDS, advances in treatment have dramatically improved their lives. Jeff Swycord, VOA News, Washington.
Thanks, Jeff, for this report. In our interview, AIDS expert Dr. Anthony Fauci shared his thoughts about HIV infection here in Washington, D.C. Again, Dr. Fauci.
3% of the people in the District of Columbia are infected. It's predominantly an African-American city. More than 60% of the people are African-American. And among African-American men, 6.5% of them are infected. That's comparable to many countries in Africa. So we need to be very aggressive in preventive measures. We need to test people widely, identify those who are infected, counsel them, and get them into treatment to bring their viral load down so that they don't then infect other people.
Well, that's today's health report.
Well, thank you, Linord. Another very informative segment of health. We really appreciate that. And for our viewers, please tune in every Tuesday and Thursday. Linord Moudou is always here with us here on In Focus.
And for more information on these stories, go to voanews.com/TV to Africa.